Hi, I'm Katie, Elemental Health's AI guide. Many patients ask about medications and substances before ketamine or Spravato treatment. The good news is that ketamine and Spravato are generally very safe to use alongside most commonly prescribed medications. However, there are a few medications and substances that can reduce or mute the dissociative or immersive quality of the experience. This does not mean treatment will not work. In many cases, ketamine and Spravato are still effective, even if the subjective experience feels lighter or less intense. The main difference is often the quality or depth of the session itself. Here are some important guidelines regarding commonly used substances and medications. Starting with substances. Alcohol should be avoided the day before and the day after treatment whenever possible. Alcohol can interfere with the therapeutic process, increase dehydration, and negatively impact recovery and neuroplasticity. Cannabis can also affect the quality of dissociation during sessions. If possible, we recommend avoiding cannabis for about 48 hours before treatment to help improve the depth and clarity of the experience. Illicit drugs should not be used before or after treatment, and we strongly recommend avoiding illicit substances entirely during your ketamine or Spravato course. Now let's review medications. Antidepressants should generally be continued exactly as prescribed. Most antidepressants are safe to continue during ketamine and Spravato treatment. Antipsychotics and mood stabilizers should also usually be continued as prescribed, unless specifically discussed with your provider. Benzodiazepines, medications like Xanax, Ativan, Valium, or Klonopin, are one of the most important medication categories to discuss with our staff, because they can significantly reduce the dissociative and therapeutic intensity of ketamine or Spravato sessions. If you only take benzodiazepines occasionally as needed, we generally recommend holding them for about 24 hours before and after treatment, if this is safe and well tolerated. For clonazepam or Klonopin, we recommend trying to hold it for about 36 hours before sessions if possible. However, if you take benzodiazepines daily, especially at higher doses, it's very important not to stop them abruptly on your own. Higher daily benzodiazepine use can increase the risk of withdrawal symptoms or seizures if stopped too quickly. Our goal is not necessarily complete discontinuation, but rather using the lowest safe and effective dose possible during treatment. Please always communicate the timing and amount of your last benzodiazepine dose to our clinical staff before sessions. In general, patients taking higher-dose benzodiazepines often respond better to ketamine infusions than Spravato, because ketamine dosing can be adjusted upward to help overcome some of the competing benzodiazepine effects. Spravato is delivered in fixed dosing amounts that may be too low to fully overcome those effects in some patients. Blood pressure medications should usually be continued normally on treatment days. Lamictal, or lamotrigine, is another medication that can somewhat reduce the dissociative experience. We typically recommend skipping the dose about 6 hours before treatment, then resuming it normally afterward. Naltrexone may also reduce the immersive quality of ketamine sessions, depending on the dose. But ketamine and Spravato can still absolutely be effective and worthwhile treatment options. Opioid pain medications may increase sedation during treatment, which is one reason ketamine and Spravato are administered in a medically supervised setting. Stimulant medications like Adderall or Vyvanse are generally safe to continue as prescribed. Some patients choose to skip stimulants on the day of treatment, but this is optional. Interestingly, some evidence suggests stimulants may mildly improve ketamine effectiveness over time. Most importantly, please never stop, skip, or change medications without discussing them with your provider first. Every patient's treatment plan is individualized, and our team is always happy to help guide you safely through medication questions before treatment. We will review your medications during your intake process. We can be reached with questions at 208-801-1414.